Hi, good afternoon. My name is David and I'm going to be your nurse this afternoon. At this point, I'll pull the curtain to provide for privacy and I'll provide hand hygiene. And then I'll ask you to please identify yourself. Can you please state your name and date of birth for me?
My name is Joshua Mejia and my date of birth is August 12, 2006.
Perfect. Your doctor tells me you're here for a focused cardio assessment,
Yes.
right? Does anybody in your family have a history of heart disease?
No.
Do you get dizzy when you stand up or change positions?
No.
Not really. So what the focused cardio assessment involves is we will be taking your blood pressure at one point from your preferred arm. Then I'll ask you to take off your shirt and listen to specific points on your chest. And at some point, I'm going to listen to a specific point on your chest for 1 minute. I'll ask you to stretch your arms forward so I can feel for your radial pulses just above your wrists. I'll ask for your fingers to observe for any clubbing and capillary refills. I'll ask you to pull up your pants a little bit so I can look at your lower extremities. And then I'll ask you to pull down your mask so I can look into your mouth. And then turn your head sideways so I can observe your neck. Are you in any pain right now?
No.
On a scale of 0 to 10, what's your pain level at?
0.
0? Alright. So now I'm gonna disinfect my stethoscope so we could get started. Okay, so I'm gonna ask to have you pull down your mask so I can look into your mouth, please. Okay, let's see. Alright, oral mucosa is pink and moist. I'm going to ask you to turn your head to your right, please, and then to your left. No jugular vein distension observed. And then I'm going to pinch your neck a little bit. Skin is non-tinting and skin color is appropriate for age and ethnicity. Alright, I'm going to ask you to take off your shirt, please.
Sure.
So I'm going to take your blood pressure. Which one is your preferred arm?
Left.
Your left? Alright, good. Okay. So I'm going to be placing the aortic arrow over his brachial artery, which is in the inner aspect of his left arm. Can you stretch your arm forward, please? Thank you. Okay, so his brachial artery, I feel the pulse right there, so I'm going to place it over that. And then I'm going to close. So, okay, I need to look at this. Thank you. Okay, I'll hold it. So I'm gonna place my diaphragm over the site where I located his brachial artery, and then I'm gonna pump until I cannot feel any pulse. Then I'm gonna release it gradually. So his blood pressure was 112/72, and heart rhythm was regular. Okay, so now I'm gonna be listening to your heart sounds. So at this point, I'll listen to his heart sounds. I'll listen to first his aortic and pulmonic, which are located on the first. I'll listen to his aortic, which is located on the second intercostal space on his right. So this is his clavicle. That is the first intercostal space, that is his rib, and that's the second intercostal space. So right here is his aortic site. So I will listen using my diaphragm. And then his pulmonic is located right across on his left, second intercostal space. So at this point, I'm listening for his S2 sounds. S2 sounds are loudest at his aortic and pulmonic sides. Then I'll move down to his fourth intercostal space and listen to his tricuspid. So I'm listening for his S1 sounds at his tricuspid. Then I'm gonna move to his mid-clavicular line on the fifth intercostal space on his left-hand side, and then listen for his epical pulse for 1 minute. So this was his fourth. So his mid-clavicular line is right here, and then his fifth. And then I'm gonna listen to it for 1 minute.